Who loves coffee? Hey guys, it's Dr. Eric, the fitness physician. Just doing a short little presentation on coffee, but threw a few posts out there about coffee because I was asking about energy drinks versus coffee. Energy drinks is a whole other conversation. Basically, bottom line is don't drink them. Water, tea, and coffee is the best way to go. But anyway, I'm going to talk a little bit about coffee. I think we all love coffee. I didn't used to like coffee. I used to hate it. I used to think it was disgusting. I eventually guess I drank a lot of tea more, and I still do. But then I'd slowly start adding coffee. Of course, I started easing my toes into it with lots of sugar and flavorings and stuff. Then got the Starbucks Mocha Loca Laca upside down, whatever, with whatever my wife ordered for me. But then I started getting just more straight coffee, just adding very less and less things to it, trying to keep it as healthy as possible. So coffee's been around for centuries, of course, and some people call it the nectar of the gods, right, or one of the other drinks. So anyway, so I'm going to talk about next one here, and the benefits of drinking coffee are numerous, right? So loaded with powerful antioxidants that can lower your risk of Alzheimer's disease. Many nutrients inside, a lot, especially the B vitamins, B1, 2, 3, and 5, and lots of magnesium, manganese, and potassium. Studies have showed increased in metabolic rates can help obviously help you more alert, right? Improve mood and brain functions, improve performance. And there's actually a lot of studies showing improved lower risk of cancer, improvement of NASH or non-alcoholic steatosis. Can't say that fast. Fatty liver and what they call NASH, and also risk of liver cancer and a lower risk of diabetes, type 2 diabetes, and improvement in metabolic syndrome. Um, and then the liver studies are very interesting because again, it's showing increase of fatty liver and the accumulation of fats in the liver. Basically, I always tell people you want your steaks marbled, but not your liver and not your body. So a lot of potential health benefits. I'll get into these in some future talks as well. Some interesting to get a little geeky on it, but some compounds that I found in coffee called CQAs. I'm not even going to try to say that word, caffeoylquinic acid. So these are what the compounds that have the antioxidant qualities, right? And especially hot brew coffee has higher concentrations of these CQAs than cold brew. So I like them both, but better more with the hotter preparations. Interestingly, a lot of people think that it stresses you out, and obviously, yes, if you're sensitive, you're drinking gallons of it, it could probably wire you a little bit, but in general, it actually improves cortisol, right? And inhibits that 11 beta hydroxysteroid dehydrogenase, which improves glucose tolerance and insulin sensitivity, which of course, one of the many things that can lead to reduced visceral fat. We all know all about the dangers of visceral fat, right? So it blocks this 11 beta HSD1 cortisol production, especially intracellular. So very interesting benefit there. That's one of the ways that it works on the cellular level. I practice cellular medicine. This is why it works. I like to get down to the nitty gritty of why things work, not just giving protocols and people don't know why they're doing. Now you understand why. Of course, coffee and caffeine can increase neuronal firing, increasing neuronal transmission from your brain to your body. So obviously, a lot of people use it for pre-workouts, stimulant effect, and of course, it can increase your basal metabolic rate and your metabolism. And as I mentioned, liver protective, right? A lot of fatty liver disease, cirrhosis, NASH, as I talked about, and these are big problems nowadays. Huge problem. Over half the population is insulin resistant, and there's a growing double-digit population of people that have liver issues, fatty liver, and issues like this. This is a very interesting benefit of coffee, right? And as I mentioned, loaded with minerals, vitamins, antioxidants, and polyphenols, which have a lot of benefit on the cells, cancer protection, antioxidant, anti-inflammatory, decreases cancer risk, of course, and some protection against heart disease, diabetes, liver disease, Alzheimer's, and Parkinson's. And even some studies indicate that may increase longevity. Up to 4 cups a day can improve health and overall improve longevity. There's these little compounds in there called phenylenedines. These inhibit the aggregation of what these little plaques called amyloid beta and tau proteins and alpha-synuclein. These are the things you hear about when people get Alzheimer's. These are those little plaques, and there's a lot of speculation as to why these happen. A lot of things have changed in terms of what's causing them. Basically, these phenylenedines, because the caffeine, chlorogenic acid, caffeic acid, quinic acid, quercetin, and the phenylenedines in the coffee helps inhibit this aggregation. In other words, it prevents these little plaques from forming. So this is one of the mechanisms that it can reduce the risk of Alzheimer's and Parkinson's. Again, this alpha-synuclein, EHA, PP2A, basically, these are all bottom lines. These are synergistic effects of all these compounds in coffee, right? There's preserved neural integrity and function, diminished inflammation in the brain, what we call neuroinflammation, and improved behavioral performance. Again, the chlorogenic acid and polyphenols are the main compounds in there that produces antioxidant, anti-inflammatory effects. And as I mentioned, the nutrients that are in the coffee, and again, as I mentioned, reduction of liver, non-alcoholic fatty liver disease, NAFLD or NAFLD, cancer and fibrosis. benefits of antioxidant support. And again, obviously people know about athletic performance, mood, and cognitive health, improvement in metabolism, insulin sensitivity, and fat burning, and reduce risk of diabetes because it protects the beta cells. These are the cells in the pancreas that produce insulin. It can protect them. It actually has a cellular protective effect. Getting back to my cellular medicine protocols, right? And there's different ways you can do this. I'm going to do another talk about the benefits of coffee for fat loss and body composition specifically. I'll talk about that later. But again, the whole point of this is that it is another cellular protocol that I utilize, and there are certain nutrients I put in my coffee to enhance these effects and enhance these compounds. So if you're interested, reach out to me. So now we're just going to get into some fun stuff, the dark roast versus the light roast. Of course, the light roast is more of a light tan color, no oils visible on the surface. Medium roast, more of a rich brown color. And the dark roast is dark brown and maybe a thin coat of surface oils, right? Light roast basically means they're lightly roasted the shortest amount of time. Raw green beans are placed in the roaster from 350 to 400 degrees Fahrenheit, and they finish them roasting when they get to about 385. For a medium roast, they may remain in the roaster for a little bit longer period, and the dark roast, of course, roasted even longer. The lighter roast typically, though, has higher antioxidants such as chlorogenic acid, and are responsible for the positive effects on inflammation, cholesterol, blood pressure. Now, they both have benefits. The lighter roast do have more of an anti-inflammatory and antioxidant benefit than the dark roast, but dark roast has some other protective benefits as well. So it's good to mix them up. The dark roast, again, this can reduce excess acid production in the stomach because it's N-methylpyridinium, and it has high levels of these phenylenedines that I talked about earlier. And again, the brain health is you want to prevent the spillover of these proteins. It's like Alzheimer's and Parkinson's, right? The other thing that can benefit is replenishing vitamin E and glutathione. So again, the benefits of light roast and dark roast. I won't read this whole slide. It's a lot, but basically different styles: espresso versus pour over versus French press, regular coffee pot, and a good old cold brew. So espresso, a lot of people like them because they're dark roast turns out to be a little bit less acidic. Light roasts are great for espresso. Pour overs, people have like the Chemex or some other brands that result in a late body and tangy coffees, more of a clear flavor. French press is a nice, easy way to go to get a rich, smooth kind of blend of flavors. So the darker and deeper notes like chocolate, caramel, and spices tend to really shine with this. So I use a French press a lot too. Of course, good old regular coffee pot, I can use for just about anything. And a cold brew, it's hard to go wrong with that, right? Different flavors, different, etc. But as I mentioned earlier, some more benefits from hot coffee. So it's good to mix these up. I use a regular pot as well as mixed up with the French press, and occasionally have an espresso. Anyway, I hope you enjoyed that presentation. If you have any questions, reach out to me, DM me if you want to know any of my secret additives. And everyone have a rocking day, and we'll talk to you soon.